Potassium is much more lethal than creatinine, and a very few people know about it. This is why today I, Dr. Purudowan, takes immense pleasure in guiding you through each and every detail about what is potassium, what role does it play in an individual's body, and why it proves to be extremely harmful for chronic kidney disease patients. Starting from basics. Potassium is a mineral that is not produced by the body via its natural process. This means that an individual can only regulate their potassium levels with the help of external factors. With helping the nerve and muscle functioning of our body, it becomes essential to keep the level of this mineral under control at all times. Let me make it even simpler. If the levels of potassium in an individual's body is normal, muscles will get a regular flow of power to keep the body in a healthy functioning state. Vice versa, if the same levels are not normal, it can lead to nausea, weakness, and even slower pulse rate. Having said that, it would not be wrong to state that the increasing levels of potassium in a kidney patient can prove to be more lethal as compared to increasing levels of creatinine. As we all know that our heart is responsible for pumping blood every second to all our organs. Therefore, if the levels of potassium are on the higher side, then it will for sure be impacted in a huge way, which can ultimately lead to a heart attack. But what does our kidneys have to do with the increasing levels of potassium in an individual's body? Do not go on the small size of this bean-shaped organ, as it performs one of the most important functions to keep you alive. Try to think of our body as a house. Every morning it becomes essential to clean it out. Now with our body doing the exact same thing, kidneys are responsible of cleaning out all the waste material that gets accumulated. Therefore, it is highly important for this organ to function properly so that it can regularly flush out all the waste from an individual's body. The relationship between kidneys and potassium is very direct. Let me explain. Decrease in kidney functioning will lead to increase in potassium levels, as the waste material will not be flushed out regularly and in a normal fashion. So it becomes very important for a kidney failure patient to control the amount of potassium in their body, as it can directly lead to a lot of health issues. But unlike creatinine and urea, both of which are produced in the body, potassium comes directly from the food we eat. That's why I advise all the CKD patients to only consume food items with lower potassium levels. But remembering what all to eat and what to avoid can be troublesome. Why I here for again. To help you in every way possible. Let me quickly go through all the food items that an individual should eat and at the same time avoid to keep the potassium levels in control. A personal rule that I always go by and even advise my patients to adhere to is absolutely say no to brown roti, green leafy vegetables like spinach, pigweed, fenugreek, mustard, coriander, mint, and tuberous vegetables like potato, sweet potato, beetroot, taro root. Coming to the food items that are safe to consume by a kidney failure patient. All the vegetables that grow on plants or creepers are absolutely safe, like cucumber, bottle gourd, bitter gourd, and okra. Also, in terms of fruits, you have to be extremely careful, as some of them may end up increasing your potassium levels. Bananas, kiwi, avocados, dry fruit, dates along with specific citrus fruits should be strictly avoided. Instead of these, you can munch on fruits like apples, papaya, guava, chiku in a limited quantity, which is approximately 1 cup. Another rule that I always tell my patients to follow is not to consume any type of juices, as it can directly contribute to increase in the levels of potassium. The logic behind this is very straightforward. For example, if an individual is consuming 1 glass of apple juice while suffering for CKD, it will have severe consequences, as almost 3 to 4 apples will be processed to get that 1 glass. Logically speaking, a kidney failure patient, therefore, will be consuming all the potassium from those 4 apples that will be present in that 1 glass, ultimately pushing the levels of potassium to a higher range. With this, there are a few other items which are rich in potassium and should be avoided. First would be low sodium salt, which is generally consumed to keep the blood pressure levels in control. But what people don't know about is that 15% more potassium is added to keep the sodium levels low in the salt that the patient would be unknowingly consuming. Secondly, for kidney failure patients, I will highly recommend that Jaggery should be avoided at all times. Let's apply the apple logic here as well. Jaggery is obtained by processing sugar canes. Concentrated version of sugar cane will contain potassium in large amounts, and therefore, even having a small piece will ultimately lead to increase in potassium levels by a high number. Instead, refined sugar can be used as an alternative whenever a kidney failure patient wants to eat something sweet. According to me, if an individual suffering from CKD keeps all these things in mind and follow my instructions carefully, then it is very much possible to get the potassium levels down. Still, if you see that even after following all these rules the potassium levels are not decreasing, I would like to then talk about something known leaching. Leaching is a process by which we can get rid of potassium from the food that is to be consumed. No matter how relieving and good this sounds, I will still not advise CKD patients to adopt this as a regular habit. But why? The process of leaching is no doubt an easy way to keep your potassium levels in control. But slowly and steadily, other useful minerals and vitamins of the body are sucked away. But if an individual wants to carry out the process, it is my duty to explain all of you of how the process of leaching is conducted. Let me take potato as an example here. High in potassium and a staple food for almost everyone on planet Earth, I often see my patients complaining about how tough it is for them to absolutely avoid it at all times. Therefore, the process that I believe works the best has 3 simple steps which an individual needs to follow for a successful process of leaching. The first step is to peel the vegetable completely. Secondly, make sure that you cut it in small cubes of approximately 1 inch. Lastly, for the process to be completed, the vegetable to be soaked in cold water for approximately 4 to 5 hours before it can be ready to hop on the pan. With all the food items that are to be avoided, I would like to mention Himalayan and sea salt as well. Both of them are highly beneficial for controlling blood pressure, but if the potassium levels are high, it is my advice to switch to common salt. So, if we wind all this up, it would be safe to say that any patient who is suffering from chronic kidney disease should avoid eating any food substance with high amount of potassium concentration. I hope this video provided you all the answers to questions, but if you still have any queries left, you can ask it in our comment section, and my team would be more than happy to solve it. So stay tuned.